Have you ever felt like every step you take becomes a pain? Your knees make clicking and popping sounds, as if they're rubbing together. This feeling is caused by osteoarthritis. Let's talk about what osteoarthritis is and how it affects old age. Hi, I'm a doctor, physiotherapist. Osteoarthritis is a degenerative joint disease. In this disease, the cartilage in our joints, which acts as a cushion and protects the joints from rubbing, gradually begins to wear down. When the cartilage wears away, the bones begin to rub together, causing knee pain. Muscles become stiff and swelling occurs, making walking difficult. Osteoarthritis increases over time and is very common in old age. It mostly targets the knees, hips, hands, and spine. But this isn't a hopeless case. It can be managed with early care, daily movement and walking, weight control, and doctor's advice. Let's talk about its management. Control your weight. Make physiotherapy and exercise your best friend. Do SLR. Lie flat on the floor. Keep one leg straight and lift the other leg straight up. Be careful not to bend your knee. Hold for 5 seconds and then gently lower it. Repeat 10 times. Do knee isometrics. Lie flat on the floor and straighten both legs. Place a towel roll or cushion under your knee and press downward. Hold for 5 seconds and then relax. Remember, osteoarthritis doesn't mean life stops. It means moving wisely and listening to your joints. Walk, avoid heavy lifting, lose weight, increase movement, and talk to your doctor. Stay healthy and motivated. If you like the video, please like and subscribe.